thing to do, and therefore they end up also trying to be like them. Not being an active member of a religious group or club, that is also one of the factors that children mentioned that also is leading them to substance use. This means that family, the primary socialization agent, has become a risk rather than a protective factor for children, as the last time most students reported using alcohol was at home or on the way there. So as parents, you need to be more vigilant, because it means that some of this is just happening at home. And in cases where parents also keep substances in the house like alcohol, that is where now children are getting to access the substances from. Do not panic. There is hope as parents. So the majority of young people do not abuse or become dependent on drugs. So therefore, children will tend to experiment with drugs, but when interventions are made early enough, then it means you're able to catch the problem early and you're able to resolve it before that moves on into something we call addiction. Many young people will be exposed to drugs and alcohol before they reach the age of 18. And as a parent and caregiver, you have a key role to play in helping empower your child to make healthy life choices and ultimately prevent them from using drugs and alcohol. Remember, as a parent, it matters to them a lot what you say. The counsel that you give to your children matters a lot. Even if at times you feel like they are not listening to you, they are rolling their eyes as you talk to them, they are listening. And that reflection comes back to them later on, and they get to understand what you are saying. So do not tire as parents from talking to your children. Keep on talking to them, because that is what will keep them going, and that is what will prevent them from using substances. So what should parents do? Well, number one, as parents, you need to be responsive, and we will be looking into details into what being responsive means and what you can do as a parent to be responsive. The importance of responsiveness. How do you, for example, communicate and relate? Good communication is the foundation of strong family relationships. Remember, when you communicate, you're able to catch problems. You're able to, see early and able to detect whether there is behavior change in your children, and therefore you're able to make interventions early enough. So developing good communication skills helps parents prevent problems, catch them early, and resolve them. So again, this is very, very key. So make sure that you actually talk to your children on a daily basis, even if it means just spending a little time with your child every day. That would make a difference in trying just to get what is happening in their lives. It is also helps to reinforce or support positive desired behavior, and helps the parent to stay aware of what is happening in their child's life. So remember, you also need to commend them when they do good or when they behave well, because most of the time you find that parents talk to their children when they have failed to do something. So also talk to them when they have done something good, just to encourage them to keep on doing good. So communication, questioning, this is how you can communicate with your children, connect and show interest or concern. Remember, as parents, you need to give time to your children. And remember, when they're trying to explain something to you and you do not give them the attention that is required, then it means that you lose them. And they will go talk to somebody else out there, and who might actually mislead your children. So encourage problem-solving skills in your children. Remember, parenting is something that, yes, lasts for a lifetime. But remember, at some point, they get out of your hands in terms of them moving out of your house and stepping outside. So encourage them to have problem-solving skills, because this will help them even when they settle out there. Listen and observe. As parents, sometimes just make sure that you listen to understand. And I keep on posing this question to parents. Is there a difference between listening and hearing? Yes, there is. Because when you listen, you give attention. But when you hear, you don't give attention. So ensure that you listen to understand by giving attention to your children. Ensure that when it is time to communicate, when it is time to address issues, ensure that you leave everything else that you are doing and focus on that your child is trying to say. Sometimes we have had cases where children have been, sexually abused, and they try to bring this up and parents just brush it off. And those children end up even suffering now from major things like depression because there was no one to listen and care for them at that point. So do not accuse. When you're dealing with very difficult issues like the issue of substance use, the issues of, for example, sexual abuse, do not accuse your child or your children. Sometimes people go into blaming, or it is the kind of dress for teenagers, for example, it is the kind of dress that you are putting on, it is the kind of company that you're keeping. That will not help at that point in time. So ensure that you are there for your children, listen to them attentively, give them the attention that they deserve. Reduce emotion. Stay calm as a parent. Strong feelings interfere with clear thinking. So when you're too upset, for example, you may not be able to make, a move in terms of solving a situation. So staying calm is something that we can look into details here. For example, as a parent, when you learn that your child is on drugs, stay calm. And calm means C stands for control your thoughts and actions. Remember, and when we are having face-to-face sessions, I usually ask parents, what would you do when you learn that your child is on drugs? When you learn that your teenager is using cannabis? And most of the responses that I get is that I will actually first, most of them will say they get angry, they, beat their children up, they take them to the police station, others do, crazy, very crazy things. But in staying calm, it means that you will control your thoughts and actions. It means that you are going to assess and decide if you are too upset to continue. So that means if you are too upset to continue with such a conversation, then leave the situation if you're feeling too angry or upset. Because when you're too upset, you may not be able to solve anything. And then make a plan to deal with the situation within 24 hours. So it means that you're staying calm, you're controlling your thoughts, you have assessed and seen that you cannot be able to handle that at that point, you have left the situation, but ensure that you come back to it within 24 hours so that you can be able to address the issue when it is still fresh. And remember, you cannot accuse without evidence. So remember, you also need to have evidence that it is true that your child is abusing drugs so that you can start addressing it from that point in time. Remember, you also need to check out for some signs and symptoms. You also need to check out for some paraphernalia, a drug-related paraphernalia. And by this, I mean things like, a matchbox. For example, a teenager is working with a matchbox. What is that for? You need to check out for that. You need to check out for some other signs like burnt fingers and stained, clothes and teeth and all that. You need to check out for them if they are trying to isolate from their other family members. So be on the lookout so that you can be able to tell whenever there is an issue with behavior change. Provide structures as parents. Children thrive in places or in situations where there is structure. And that is why you find that children do well in school. Because in school, they know from 8, for example, to 10, they're having lessons. Then from 10:30 to 11, they're having a break. So it works very smoothly and well for them because it is structured. So at home, we also need to put in some form of structure, put in some form of rules and regulations, boundaries and limits that will guide family life. Because children do work well where there is structure, where there is organization. So without an organized structure, then children are left to do as they feel, to do what they want to do at their own time. That brings chaos within the family. So children both need affection and structure in order to develop into secure, happy adults. Routines are the building blocks or habits, which in turn build character. So remember, as families, you need to develop routines, you need to develop rituals like eating together, praying together, playing together, working together. At the end of it all brings cohesion in the family. And setting limits helps parents teach self-control and responsibility. Remember, taking responsibility is very, very important. And as children grow up to become teenagers and young adults, they need to learn the aspect of self-control. And especially when it comes to issues like anger, as parents, you need to train your children to control their anger. Just like you stay calm as a parent when you realize there is an issue, you also need to help your children to have self-control. And then order helps build a sense of safety. Rituals build a sense of belonging and pass on values. So rituals are also an important aspect of family, cohesiveness. And this, it means very, very basic things, just like eating together, for example. I know it is challenging, like in Nairobi, for people to maybe eat together during all meals, but at least in one meal per day, just ensure as a family you eat together so that you get to, even talk to your children and just interact at that level. So still on structure, establish and communicate clear rules for the family, and set and communicate rules and consequences clearly. Be consistent with the rules. And what I will insist here most on is following up on the consequences. When, for example, you have set a rule and somebody does not follow that rule, it is important that you follow up on the consequences so that next time they're able to obey those rules. And consequences do not mean physical punishment, for example. Consequences do mean things like, for example, denying a privilege to watch maybe the favorite program on TV, or maybe just to play a game on internet. So it means that you can do a lot as parents just to follow through the consequences and ensure that there is order in the family. Then structure the routines of life as much as possible. Chores, house chores are important, that children participate in house chores, the rituals we were talking about, and family activities. So once in a while, just ensure that you plan family activities together and ensure that members participate. Then discipline your child. Follow through each time a limit is stretched or a rule is broken. Offer encouragement at each time, a rule is followed. So it is the duty of a parent to ensure that you also discipline your child. Remember, we are not talking about punishing, we are talking about discipline. So following through when the limit is stretched or a rule is broken, and offering encouragement at any time a rule is followed. So that would encourage them to follow up with the rules, and that will encourage them to keep on doing what is expected of them. Being involved. I think this is one of the most important things that you also can't leave out as a parent. On being involved, it means that you need to spend time with the children because this nurtures relationships and shows them that you care. Supervision helps you recognize developing problems, promote safety, and stay involved. As children develop into teenagers, parents might view them as more independent and less in need of monitoring. But consistent monitoring throughout the teenage years is critical because the desire to be independent can bring opportunities for unhealthy and unsafe behaviors. So remember, as children grow up and they develop independence, you also still need to keep on monitoring as a parent. And as they grow up and probably leave your house and go to college, remember, as a parent, you need to keep your line of communication open with them, so that in the event that they are exposed to the unsafe behaviors we are talking about, or the unhealthy behaviors that we are talking about, then your children can see you as a support system. They can call you, they can be able to share with you whatever is going on in their lives. Then monitor and supervise schoolwork and other activities. Build positive learning habits. Be responsible for sex and drug information. Monitor their screen and media time. Get to know their friends and friends' parents. Talk and listen to their feelings and thinking often. Monitor their use of pocket money. Very, very important, because most of the time people would ask questions on how to monitor or how to supervise. So build positive learning habits. Be responsible for sex and drug information. And we'll see later that when children learn about such things from their parents, rather than from elsewhere, you'll find that that will act as a protective factor for them not to engage in substance use. So monitor their screen time and media time. Remember, there are so many things that children get exposed to on the internet and even on TV. Ensure that once in a while, you just sit down with them and watch a program with them and just get to see what your children are exposed to. Get to know their friends and their friends' parents. It is important because you get to understand what values their friends carry and what their values their parents also carry, so that you avoid a situation where your children, you could have prevented your children from substance use in your house, but then they get exposed to substances in their friend's house. So talk and listen to their feelings and thinking often, and monitor the use of pocket money. Spend time with them. 15 minutes per child per day. And even if you can't manage 15 minutes, you can do 10 minutes per child per day. It is important that you spend that personal time with your child, because all the children have different needs and they express them differently. So sometimes when you have them lumped together, for example, a teenager may not be able to speak out when amongst the young children. And then family activities and bonding, which is also something very, very important to just get the whole family involved. So remember, as a parent, your opinion matters. Drug use prevention starts with parents learning how to talk to their children or with their children about difficult topics. The children who learn about dangers of drugs, for example, underage drinking and other risky behaviors from their parents, are less likely to engage in them. So remember, your opinion really, really matters. So just take time. And as parents, maybe you might be asking questions on where to get such kind of information so that you can share with your children. On our website, again, we have booklets that we have developed, a guide for parents, a guide for teachers, a guide for young children, a guide for teenagers. So you can be able to, download these books from our website and share the information in there with your children. So drugs, including tobacco and alcohol, are easily available to children and adolescents. And as a parent, you have a major impact on your child's decision not to use tobacco, alcohol, and other drugs. Ensure that you are responsive, provide structure, and be involved in your child's life. So remember, being involved is very, very important. Providing structure is equally important. And being responsive is also most important. So ensure that you are there for your children. Ensure that you share with your children information concerning sex, for example, concerning substance use. Ensure that you are the first one to share such critical information with your children, because in most cases, they usually get the wrong information out there. So ensure as a parent that you're there, you're available for your children. So I thank you for listening to us. Now we welcome any questions, any comments, concerns, or fears. And before we answer your questions, we have a toll-free helpline. The number is 1192 or 1192. Right now it operates from 8 a.m. to 5 p.m. or 4 p.m., sorry. So in the event that as parents you require counseling, in the event that you have questions concerning a substance use, in the event that you need referrals as to where you can be able to take your children for counseling, this is the number you can call. We offer counseling through that number and referral to other service providers. So I'll take it back to Mr. Masharia for questions and comments. Thank you very much.
Thank you so much, our sister Teresa, for taking us through that session. And I believe parents, all of us have learned something today. It has not been a waste of time to have joined us, to have logged into this webinar this day. Teresa has taken us through very crucial and very important things that as parents we need to learn, as parents that we need to know, that we can be able to bring our children where in this particular time, in this particular duration where we have a lot of problems. Globally, people are going through very many challenges. And one of the biggest challenges is the issue of drugs, which is cutting across all over the world. Kenya is not an exception. And us, as the people of Kenya, we are not an exception. And our children are affected equally. If we are not affected, maybe your neighbor or your friend's child has been affected by the issues of drug. And therefore, we are lucky that we have had an opportunity to hear on how we can be able to mitigate issues of drugs in our homes as parents, because charity begins at home. And therefore, maybe I wanted to ask Teresa, does this saying, which says, mangi see, mangi do, is it really in terms of issues of drug as it pertains to parents?
Yes, it is. And to tie that with the same children see, children do, as I was talking about the issue of role modeling, it is important that parents set the best example they can for their children. If you have to use substances, ensure that you use them away from your children, because if you do, then the children believe that whatever parents do is right. And therefore, if you use substances, within the precincts where your children are, then it means at some point your children will want to, use it. And they will want to, even we have had a situation where children will take wine, for example, from the fridge, put in a little in the glass and then add water to the wine so that the parent cannot be able to know. So it is important that parents set the best example they can for their children. It relates very well in terms of.
Thank you very much, Teresa, for that elaboration. So parents, you can see whatever we do at home, how we conduct ourselves, the way we do our things at home, reflect on how our children do, because they observe. And one of the most important things that children do is observing. And what they observe the parents doing, they'll eventually be able to do it, because we are role models, and therefore we should be good role models in our society, in our families, and even at our home, so that we can be able to impose good morals into our children, so that they cannot be able to engage in these issues of drugs. So I thank you so much. Maybe if our parents have questions that you'd want to put to us, I would ask you maybe to unmute your mic and maybe just ask your question. This forum is open for a short time so that we can be able to answer your question. The panelists are ready to be able to take on your questions and answer them. If there is any question, you can unmute, parents, you can unmute your mic and be able to answer it. I can see several questions on our chat and question and answer. Some of them we have already answered them. But if there's a question that we have not answered, kindly you can be able to ask.
Mr. Masharia, as they asked, I think I had seen one question on the chat, which was asking about how prescription drugs are abused. Yes, prescription drugs are abused in the manner that these other drugs. When you use a legal drug in the manner that is not prescribed to you by a doctor, for example, when you use somebody else's prescription to buy medication, that means you're also abusing that medication because it wasn't meant for you. When you, for example, share medicine with somebody else, I have had a situation where somebody complains of a headache and somebody else says, I have some, diclofenac here, which I was given. It is very effective, so you can have some. That is also a form of abuse. But the other also form of abuse that comes in with prescription drugs is where now people buy drugs like Valium, which naturally would induce sleep, and start using such kind of a drug to be able to get sleep. So at some point, you'll find that you are unable to get sleep naturally until you get to use that drugs, or at that point you are abusing the drug because it has not been prescribed to you by a doctor, but you're using it by virtue of it will be able to induce sleep to you. We have had issues of people also abusing prescription medications meant to treat mental conditions. And you find that at that point, when you use such medication just to get the feeling that you want to get out of it, remember now when you get to a point where you develop the mental condition, it means that you will already have developed resistance to such medication, and therefore your treatment in terms of the mental condition becomes very complicated. Thank you.
Thank you very much. Maybe we can also check any other questions that we have in our chats, the panelists, so that we can be able to answer some of those questions.
Yeah, there is another question here on how do you observe for addiction, or for example, how can you tell somebody is addicted to a substance? The psycho addiction does not start or begin or happen in a day. It is a process that takes time. And at times, depending on the individual and the genetic makeup, sometimes it might take even 10 years for one to become dependent or addicted to a substance. So for one, when you, if somebody is addicted to a substance or dependent on a substance, then it means this person is unable to function normally, that is in quotes, without having to use the substance. It means that this person suffers from withdrawal symptoms whenever the level of the substance goes down. It means that this is a person who needs actually a wide range of interventions in terms of treating the addiction or the dependency. So it means that there are signs that you can be able to watch out for, including physical signs, where somebody becomes, physically, emaciated because of when you use the substance and become dependent on it. The people ignore on other aspects of life, aspects like hygiene, aspects like feeding. So you find that that person becomes physically emaciated. And also the setting in of other illnesses. Like, for example, if it is for somebody who uses alcohol, then you find that they go ahead and develop things like diabetes, high blood pressure. It could even develop something like liver cirrhosis. So there are so many signs that could help you tell that somebody is actually dependent on a substance. Thank you.
Thank you very much, Teresa. There is also another question on where they can get us. And I want to say we are located in an NSSF building, annex building. That's where we are. You come there, you find Nairobi Regional Office. Or you can also get us through our email, nairobi@nakada.go.ke. And you can also get us maybe through info@nakada.go.ke. So those contacts, you're able to reach us so that we can also to be able to interact with you in a better way, in a closer way. Thank you. I don't know whether there is any other questions that we would need to answer.
Yes, there is a question here asking on, can NACADA have drug abuse included in the school syllabus for primary to high school? I would say yes, there are efforts. We are working with the Ministry of Education to ensure that this kind of education is included in the syllabus or in the curriculum. And if you interact with your children, well, children from class 5 will tell you that they learn this kind of stuff in the science subject, class 6 and even 7. So we are still working to ensure that it is fully integrated into the curriculum. But right now, I know there is some education that is going on. And as an authority, we also run some programs in schools. It's only that the COVID pandemic has, stopped us from accessing schools. So we also have got the life skills program that we also offer in schools. So hopefully in future, we will be able to roll out the program again. But we had done that in a few schools and it was working very well. Thank you.
So I don't think I can see any other question. Maybe.
Yeah, yes, there is another question, Mr. Masharia. What does NACADA do to organizations that need similar training to be conducted to community? Sorry?
No, proceed.
Yeah, the similar trainings to be conducted in community. As an authority, we run also trainings at different levels. At the community level, yes, we can conduct this training, but remember now during the COVID pandemic, with the challenges that we are facing, we are unable to do in-person trainings. But should the situation, improve, then we will resume to doing in-person trainings. But we have other trainings on workplace prevention. We have other trainings on community prevention, which we can carry on later on. So currently what we are running online is workplace-based prevention programs. We can be able to roll out community programs once the COVID situation improves. Thank you. There is another question here. Somebody says, I love my kids a lot, and I'm also one of the drugs victim. How can I do so that I can have time with my kids? Because sometimes I fear coming home early. So this is a parent who is concerned about his own substance use, and is concerned because he's unable to come home early and interact with the children. I think my advice to this parent is that they need to set aside some time that they are not using the substance so that they can come home early and interact with their children. And should you require help on how you can stop your use of the substance, kindly get in touch with us on 1192, the number I had shared before. We will offer you counseling and also maybe refer you somewhere else for further help. There is another question here from Owidi Collins. What is NACADA doing to stop local radio stations that promote drug use, i.e. bang use? So this is a person who feels that there are some local stations that promote drug use. I don't know in what way, maybe he could have elaborated further, but maybe it could be in relation to some music that is listened on our radios. I'm not very sure how the promotion comes in, but I think it is something we can pick up later on. There is another question here. Why does NACADA not hold Zoom meetings with the youth as they do? So this is a challenge to NACADA, that as you hold the Zoom meetings for parents, you also need to consider holding a Zoom meeting for the youth. And I think that is something we can plan for. Thank you so much, Moreidi, for your question. I think so far, I don't see any other question. Back to you, Mr. Macharia.
Thank you so much, Teresa, for answering those questions that came on board. I'm sorry to our parents that we are not able to allow you to ask your questions because of some technical issues. That's why we are asking you to use our chats or question and answer place so that you can be able to reach us. I can now see on board we have our Director, Public Education and Advocacy and Rehabilitation, who is on board. I wanted to give her a chance to greet us and maybe say a word. Madam Yvonne, I can see you around. Kindly.
Maybe Macharia, before you get there, if you look at the chat, there are so many questions.
Yes, I have seen the questions.
There are many questions, and you sound like you are winding up, and somebody says, "Please answer my question on rehabilitation center." So you may want
to wind it up, Susan. Point taken. Point taken, Susan.
Okay.
We have not winded up. Maybe I just saw she's on board, and I felt maybe she can say something as we proceed. Maybe even some of those questions she should be able, maybe even to say something on them. Thank you.
Yes.
All right. Okay.
Madam Yvonne.
Thank you, Bwana Macharia. Thank you very much, Teresa, for that very excellent presentation. Just to say a few and maybe to answer one or two questions. I've seen a few questions on rehabilitations in Kenya. Maybe just to highlight, if you go to the NACADA website, we have a list of accredited rehabilitation centers. Also, we have rehabilitation centers that are NHIF accredited. These are the ones that might be more affordable. In Miritini, we also have a rehabilitation program that is very, very affordable. So you can also check and you can admit some of your people there. So if your person is NHIF accredited, that means that about 60,000 of their bill will be taken care of. So check the website, identify the rehabs that are NHIF accredited, and you will be sorted. Somebody else mentioned that parents are also very frustrated. They are also very stressed. And that is one of the reasons they are not able to take care of their children, that maybe we need to take care of the parents first. And that is a very good point that has been raised. And I believe it is something that we can take up. In the meantime, parents, we say that you have to do your own daily cleaning. And that means that you need to get somebody that you can be talking to so that you do not burn out. There are very many facilities available. One of them is our toll-free helpline, 1192. Call and there will be somebody there to assist you. Otherwise, I'd like to appreciate all of you for joining us. I believe I'll be coming back maybe at the end to give a final and invite you for our next webinar session. Back to you, Mr. Macharia.
Thank you so much, our director, for that insight and even for giving more info on the issues of rehabilitation. We go back to our questions as Susan had requested. We are not winded up. We still have some time. Teresa, I'm back to you again.
Yes. There is somebody who is suggesting that we need to hold more forums in Kenya. And to answer that, I will say that we are holding regional forums. We had the first one in Eastern, the second one here in Nairobi, and I think there are about 6 more forums to come. So keep in touch with us on our social media platforms, on our website. we will be posting this information on the upcoming forums. Somebody is also asking about how we can support them who deal with the issues of gender-based violence, because most of the time it is related to substance use. And I would say that as an authority, we are open to partnerships. Write to us. You can get our details on our website. Like to be specific, this was from Makueni Referral Hospital. You can get in touch with our Eastern office, which is in Embu, which covers your region. So get in touch with us and we will be pleased to, partner with you. On the issue of rehabilitation centers, why are rehabs so expensive? Are there cheaper ones by government? I think Madam Yvonne has been able to tackle that. So ensure that you also get to our website to access the list of accredited treatment facilities. And maybe just to mention, for the people in Nairobi and the youth who are struggling with substance use, we also have a Kenyatta National Hospital Youth Center, where the services are offered free of charge. Maybe the only thing that you are required to pay for is a drug test, but you can see a psychiatrist, you can see a psychologist, your child can get counseling, in-person counseling there, and just to help them navigate the issue of substance use. Can these programs be rolled out to churches and mosques? Oh yes, I think this is something that is possible. Of course, with the challenge of COVID-19 that we are going through now, it is not possible for us to run in-person meetings, but we can always organize to have Zoom meetings for now for churches and mosques so that we can keep on passing this information to our Kenyans. I kindly request if you can conduct such training for healthcare workers, teachers, and Ministry of Gender, Health, and Education. I think this is something that is possible. We are open to partnerships, and we have been working with many ministries and government departments just to support them, for example, in mainstreaming the issues of substance use or alcohol and drug abuse in the workplace. So feel free to, get in touch with us. We will be glad to partner with you. When are we meeting again for full board training and empowerment? Somebody is asking when we will be meeting again. I think since this is the beginning, we will always have future meetings to conduct, and therefore we will keep you posted on the future meetings. What is NACADA doing to stop pubs and that sell alcohol to everyone during the day? I have reported this to the chief severally and nothing is done. Children are at home. How do we help? The players, the place is once during the day is Rai Moihoko opposite Orange House. I think we can.
Can I maybe answer that?
Yes, please.
Yeah, thank you so much. I had seen that chat from one of our parents concerned about a pub in Githurai that is opening during the day. And I want to inform you parents that this is the biggest challenge that we have in Nairobi. Many pubs are opening during the day. They are not observing the rules that have been set in terms of the operation of opening alcohol selling outlets in the country. And what we do as NACADA, basically, one, we are not the licensing agents. And therefore, for us to be able to rein on these rogue persons and patrons who open their premises when they are not supposed to open that, we normally work closely with the national government. We work very closely with the National Police Service to be able to rein, and the county government to be able to rein who are the licensees of those premises, to be able to rein on those premises so that we ensure they comply with the law. So we will take up that point, that issue with the county government of Nairobi to be able to see to it that that issue is addressed, and so that that particular place is not open during the day, because I know it is a nuisance to our children, because what they see is not something that will embrace them. And some of those things they see, especially when our people are drunk, they are not very, very, very good. Thank you so much.
Back to you, Mr. Macharia. There are some people or parents who have raised up their hands. I think they want to ask questions or just make comments. I think we can allow them some time.
Teresa, I'm sorry, we are not able to, technically, we are not able to allow them to ask their questions. That's why we said initially they should be able to use the chat or the question and answer options to be able to reach us.
I am told that the link has been enabled for them to ask. So maybe we can give one or two of them.
Okay.
One or two of them to ask or make a comment.
Okay.
So maybe we could ask Kennedy.
Yeah.
Kennedy, kindly unmute and go on. Kennedy seems not to be ready. Crispin Okello.
Hello.
Yes, Kennedy, go on.
This is Crispin.
Hello.
This is Crispin.
Okay,
Oh,
sorry.
hello.
Then we can.
We can hear you, Kennedy.
Hello.
Proceed. Yes,
Hello?
Kennedy, we can hear you. Proceed.
Yes, I'm just asking,
Yes.
as the organization, the way we have had the teaching, it is so good. And sometimes we want to reach our beneficiaries with the same materials, because some can read and understand when we explain to them. How can the organization that working with the community can get such material? Number two, is there any time if the organization has seminars, the NACADA can send the facilitators to that organization, because we have the organization that deals with the widows and orphans, but the widows pass through the traumas and the difficult issues. So can the NACADA provide us with the facilitators that can at least assist the widows during our seminars when we shall be back to the seminars in the gathering?
Thank you so much, Kennedy, for your question. I want to assure you that NACADA works very closely with the community. NACADA works very closely with the various organizations in the community, and we shall be willing if we are invited to participate and facilitate whenever you need us on issues of alcohol and drug abuse within the community, within your organization. So you will always contact us through the contacts that we have given you when you have such a forum. And I want to believe this should be after maybe the lockdown is over and the containment measures are over. We are open, we are ready. We have enough facilitators to be able to do that. So you are most welcome to reach us, and I know we'll be able to do that for you. We will also be able to send to you through email. Share with us your email. We'll be able to send you the presentation so that you can have it. Thank you so much.
Thank you, Mr. Macharia. Crispin Okello, kindly unmute and ask your question.
Yes. Good morning. My name is Crispin, and I'm of course I.
Hello, we can't hear you, Crispin. We can't hear you.
Oh, hello.
Yes, now we can hear you.
Oh, thank you. I'm saying my name is Crispin, and I'm working for Child Space Organization in Ruaraka, Babadogo, and my question is not really a question, my suggestion, because what already you are doing, I've been following this, what NACADA is doing together with our team here, and we have seen some progress. You go to Radio Maisha, you go everywhere. We are following everywhere what NACADA is doing, because that we are into prevention of drug and substance abuse as well. Mm-hmm. Yeah, but now the suggestion is a lot, even the ongoing CND already, a lot has been said, but now our suggestion is, are we now in a position as NACADA, how can NACADA be in a position now to just, we come up with the say, what can we call this? We say the good things, yeah? Good things that can happen, the benefits of staying sober vis-a-vis, or instead of coming up with you're just saying that the effects and the effect and effects. The effects, we have so many myths, and you've been demystifying this over time. So if possible, is it correct that we can now come up with pamphlet of saying the benefits of staying sober, the benefits of abstaining from this to the young people, so that they consume this, the benefits, say like 5 or 10 benefits of staying sober at this age, something like that. So it's just a suggestion, because we find this working with our Smart Children Club that we are trying to do mentorship here in Babadogo. Thank you.
Thank you so much, Crispin. Your opinion is welcomed, and we take it on board because we are here to learn, all of us. So NACADA does not own monopoly of knowledge. We are here to learn. And we are ready to incorporate some of those views that we feel are good, beneficial, useful to our community, to our people, to our children. Thank you so much for your comments.
Thank you so much, sir.
Thank you. Moreidi Evans, you can unmute and ask your question.
Hello.
Hello.
Yes, I'm Evans Moreidi from Meru.
Yes.
So first of all, I would like to thank Madam Teresa for the nice presentation that she has made.
Yes.
Secondly, it's to ask if Nakada can host some Zoom meetings for the youths, because sometimes some parents are busy. Like as when we are growing up, you will meet that the parent, you don't have anybody at home. You move out of school, in the evening you come, you meet only the house help. So the parent doesn't have time for you. So most of the things that a parent should teach you, you are lacking them. So when you grow up, it reaches a time that you see that, oh, things like this at that time I was not told. But you see, when people like Nakada can join and start Zoom for the youths, they can be able to help them, guide them somewhere, like on matters on drugs. There are some things that some parents can't tell their children. It's like they fear them, or I don't know what, so they can't say. But people from Nakada can help them, and that child can be able to change from there. Thank you.
Thank you so much. Your point is well taken. And I think Teresa can say something on that.
Yes, I think we have been challenged by somebody else also to try and do Zoom meetings for the youth. I think it is a challenge we are gladly taking up. So probably the next Zoom meeting we'll be having as Nairobi region, it should be focused on the youth. I think there is one last hand from Nokia. Nokia, somebody, kindly unmute and ask your question. Nokia C2.
Good afternoon.
Afternoon.
Yeah, my name is Lydia Mbaria.
Yes, Lydia.
My name is Lydia Mbaria.
Welcome, Lydia.
I wish to thank you for this very informative presentation. At the same time, I would want to ask you, what are you doing for people with a disability? Because we also belong to the society. And of course, some of these things, or the addicts, we also have them within our society who are persons with a disability. My question is, are you trying also to reach, or have you planned, do you have a plan of reaching groups of people with a disability? Because even as we talk about the media, know that at times, if we talk about the media, in the TV, maybe the people with the hearing impairment will not even hear what is whatever is being advertised. If you talk about the radios, you see at times even people with disability even cannot even afford even a radio, because disability and poverty, they are twin brothers. So maybe even as you hold your meetings, try to see whether you can be able to reach people with the disability, the groups themselves, because from there they will be able to get the information. Because even as you put whatever the flyers are all over, and we are talking about the print media, what about that person with the visual impairments cannot be able to get that information? And also we would also wish that you would also focus on how to prevent people going into addiction, so that we can have a sober society. Because when we have a sober society, we'll be able to move forward, because with the drugs, it drags the society behind. Thank you so much.
Thank you so much, Lydia. I can see Susan is on board. Maybe I will ask Susan maybe to just say a word on that. Susan Karibu, Susan Mawa.
Thank you, Ms. Masharia. Now, we have a number of ways of reaching. First of all, we do not discriminate because somebody has a disability. When we reach out to young people, for example, it is young people irrespective of disability. But we also appreciate that there are those who are not able to reach. We are not able to reach out. But remember, we also work closely with the National Council for Persons with Disability. So we have some of their materials in Braille. Yeah. So when we know of people who are in need of those services, then the braille materials are shared. And these braille materials are even available in our regional offices. If you go to our website also, you're going to find that we have that one for disability, for persons with disability, so that even if they are, hard of hearing, then they can also be able to access the materials. So there are many ways. There's not just one strategy. Even if you look at the content that has been developed for the CBC curriculum, you're going to find that even those with special needs are also catered for. All right. But if we have any, like specific groups, as Nairobi region has said, getting into contact with them so that the issues are addressed is the best way forward. Thank you.
Thank you so much, Susan. Teresa, are you seeing any other person maybe who needs?
Yes, no hand raised up, but there is a concern here about CHVs, whether we can train CHVs. And I think that is something that is possible in the current financial year. I think we trained a number of them, and whoever is asking this, just get in touch with us. We can organize for the training probably later on. And then there's somebody from NMS who is asking whether we could train their staff, even if it means on Zoom. I would just request that they get in touch with us so that we plan on how we can be able to do such a meeting for them. I don't seem to see any other.
Okay. Thank you so much, Teresa.
There is somebody from Eden Therapy Center who is asking whether we could partner to create awareness within the community in Eastlands. I think it is something which is possible. Kindly get in touch with us.
I can see Susan Mudama.
Yes, yes. Yes.
Susan.
Kindly unmute and move on. Susan Mudama.
Hello.
Hello.
My name is Susan Mudama from Dagoretti.
Yes.
And we have a lot of youths who are abusing alcohol and drugs. Now, substance abuse. Now, I have been taking a few last year in my compound and talking about drugs and the like. And then I stopped because I thought maybe it was against the rules of having this distance, keeping distance. Now, I was requesting, can you people be coming to the chief's office and then maybe organize something in the hall and talk to the youth?
Thank you, Susan, for your comments and your inquiry. I want to believe if you can reach us, we can be able to make arrangements on how we can meet you and make arrangements on how we can meet those youths, maybe at the chief's place, so that we can be able to sensitize them. So just make an effort to reach us in our offices or through our contacts, and we'll be able to assist you where we can. Thank you.
Thank you.
There is Celestine. Celestine, kindly unmute and ask your question or comment. Celestine?
My name is Celestine.
Yes, Celestine.
Just wanted to find out, first of all, thank you so much for this session. I'm a member of ADA committee, and I just wanted to find out if there are support groups from people who come from rehabilitation centers.
Celestine, I didn't get your question.
She's asking about support groups. Sorry.
Yes, I was asking whether there are support groups for people who come from rehabilitation centers.
Yes, thank you so much. I can hand over you to Teresa. I know she knows there are so many support groups which can be able to help those people who have come from the rehab. Teresa?
Yeah, thank you, Celestine, for your question. Yes, there are a number of support groups here in Nairobi and some outside Nairobi. So what you need to do is to get in touch with us through our helpline 1192, and you will get information, specific information on where those meetings are held and the time. You could also be able to get that also online. So when you Google just AA or support meetings in Kenya, a list of the meetings will come together with their hotline number. So you can either get in touch with us for the information, or you could get it online also. Thank you. There is someone who is asking how to convince someone that they are addicted who does not believe. I think they are talking about denial and how you could help somebody navigate that and probably be able to seek for help. You could also link that person with our helpline for counseling and referral to treatment centers. So I think I will, there's a hand from Faith Modoni. Kindly, Faith, unmute and ask your question.
Yes, is it good afternoon already? Thank you so much, Nakada. Yeah, my name is Faith Modoni, the CEO Parastato News, and I'm also the national chairperson of Grassroots Women Association and also the board chair for Langata West Primary. First of all is to thank NACADA. I've worked with you all over the country, and I must commend your work. The other day we partnered with you to come to our school, Langata West Primary, and a lot has been done, and there is a lot of change. So I just want to tell all the listeners that NACADA doors are open, and let us hold each other hard to make sure that we have the drugs and alcohol abuse have reduced. I know during this lockdown, and because of the pandemic, a lot have been done. Most people has gone through depression, stress, and they end up using drugs and alcohol maybe to soothe their problem. But at the end of the day, they find themselves into dangerous situation. So I would urge, as we have been gone through the presentation, today's presentation, to partner with NACADA and for the sake of our community. So that's what I can say. Thank you so much, NACADA.
Thank you so much, Mudoni, for your comments, and we thank you so much even for the support that you have given the Nairobi Regional Office in terms of reaching those children in schools. We thank you so much. I want now to hand over this meeting to our director so that she can give us some closing remarks so that we can wind up this meeting. Thank you so much, every parent, for your support, for being there for us, for listening to us. And I want to believe that all that we have learned will go a long way in improving the lives of our children. Madam Director, karibu.
Thank you so much, Bwana Macharia, Triza, and the whole Nairobi region. That was a very well organized webinar. Thank you to the participants for attending and staying online the whole time. Thank you also for your very, very insightful questions, most of which will actually help us to strengthen our programs. We shall be offering this kind of webinars for the whole of April, May, and June. This will be broadcasted on our website as well as on the Facebook pages and our Twitter handles. Then you can be able to see what program you could be interested in. As has been mentioned over and over, if you need any kind of support to do with counseling or treatment, kindly get in touch with our helpline 1192. They'll be able to assist you. Somebody talked about people going to their home to assist a client who maybe has an alcohol use disorder. Our counselors will be able to direct you in the right way to handle it so that it doesn't become even a worse situation. Remember again, assessment is very key. So this is where the helpline will come in. So asanteni sana for your time. See you again next week. Thank you.
Thank you so much, Madam Director. Maybe I can ask one of the parents to close for us with a word of prayer. One of them can raise the hand. Just close for us with a word of prayer. Any of our parents who is ready? Yes, I can see Muredi Evans. Unmute and pray for us shortly.
Okay, let us pray. Thank you, our loving Father, for this day that you have granted unto us. Thank you for this Zoom meeting that has been held here. God, whatever we have learned, made beneficial to us. May be able to use it to our children, also to help others out there, so they can be able to be helped. Also, we pray for Nakada, everybody who has organized for this Zoom meeting. Continue blessing them as they are continuing as they are continuing to prepare for more and more Zoom meetings. Continue being with them, continue being with everybody, God, and also help us. We pray this through Christ our Lord. Amen.
Thank you so much, parents. We want to stop there, and God bless you and have a wonderful time. Thank you so much.